Pregnancy Week 10. You are now 10 weeks pregnant, which means you are nearing the end of your first trimester. As your uterus expands, you may notice your belly growing rounder. You and your baby are experiencing rapid changes in your pregnancy. By the end of this week, your baby will officially graduate from the embryo stage to the fetus stage. Your baby's vital organs are formed, and the placenta functions properly. Week 10 Pregnancy Ultrasound. At 10 weeks of pregnancy, you will be advised to undergo an ultrasound scan to determine your baby's progress and health. The ultrasound at this stage can help check the speed of the baby's heartbeat and general well-being. It can also predict the baby's due date and normal growth. At 10 weeks of pregnancy, an ultrasound can reveal more details about any abnormalities in the fetus, such as Down syndrome. It can also check for normal spine development, determine the normalcy of the internal organs, rule out ectopic pregnancy, and choose the location of your baby. Week 10 Size of the baby. Your baby is rapidly growing at 10 weeks pregnant, measuring about 1.2 inches long and weighing 0.14 ounces, similar to the size of a strawberry. Week 10 Baby's development. By the beginning of the 10th week of pregnancy, your baby's vital organs have already formed. The embryonic tail, located at the bottom of the spinal cord, has disappeared, and the bones continue developing. The ears are close to their final form, and teeth buds emerge while the eyelids develop further. Also, the tiny fingers and toes are fully separated, and there is no more webbing. During the 10th week of pregnancy, your baby's testes start producing male hormones, testosterone. Your baby's brain growth takes off at this point, producing 250,000 new neurons every minute. Week 10 Pregnancy Belly. Every expectant mother has a unique body shape and size, so their baby bump will look different. The shape of your uterus can also affect the appearance of your bump. At 10 weeks pregnant, your belly may start to show as your baby grows rapidly, causing your tummy to round out. If you're pregnant with more than one baby, you'll likely develop a noticeable bump during your first trimester. Week 10 Pregnancy Body Changes. As your pregnancy progresses, you may notice the veins in your breast and abdomen becoming more prominent, while your abdomen may ache due to its expanding size. This could be a sign of your uterus growing or sensing increased blood flow, which may also cause pressure in your lower abdomen and frequent urination. You may experience changes in your eyes, such as the cornea getting slightly thicker due to fluid retention during pregnancy, causing dry eyes or puffy eyelids. However, these symptoms are temporary and your eyes will return to normal after giving birth. If you experience intense symptoms, speak to your doctor immediately. Week 10 Pregnancy Symptoms. Round ligament pain. Sharp, shooting pains in the lower abdomen or groin area due to the stretching of ligaments that support the uterus. Growing breasts. You may notice your breasts becoming larger and more tender as they prepare for breastfeeding. Increased vaginal discharge. A normal increase in vaginal discharge, known as leukorrhea, is expected due to hormonal changes. Morning sickness. Nausea and vomiting, typically occurring in the morning but can happen at any time of the day. Visible larger veins. Increased blood flow may cause veins, particularly in the breasts and abdomen, to become more visible. Heartburn and indigestion. The growing uterus puts pressure on the stomach, leading to heartburn and indigestion. Frequent urination. Pressure on the bladder from the growing uterus can lead to more frequent trips to the bathroom. Fatigue. Feeling extra tired as your body works hard to support the pregnancy and changes. Week 10 Pregnancy Checklist. Wear comfortable, stretchy bras and clothes to accommodate your changing body. Schedule your first trimester screening to assess your baby's health. If you opt for it, schedule your chorionic villus sampling, CVS, test to detect genetic abnormalities. Schedule your nuchal translucency, NT, screening to assess the risk of chromosomal abnormalities. Consider going for the non-invasive prenatal testing, NIPT, blood test to screen for Down syndrome. Make an appointment with your dentist to ensure your dental health is checked during pregnancy. Start thinking about how and when you want to share the exciting news with your loved ones. Start exploring nursery ideas to plan for your baby's arrival. Week 10 Pregnancy Tips. Consider using a pregnancy or body pillow to support your changing body and help you rest more comfortably. Get plenty of calcium and prenatal vitamins as your doctor recommends, as these nutrients are essential for your baby's bone development and overall health. Maintain a healthy routine by following a balanced diet, staying hydrated, exercising, and getting enough sleep to support your well-being and your baby's growth. Moisturize your belly, hips, and thighs daily to prevent itchy, dry skin as it stretches. Avoid chemical treatments on your hair, as they may contain components that could harm the baby. Reduce your intake of caffeine to support a healthy pregnancy. For more videos like this, please like, share, and subscribe.